Today marks World Menopause Day, and it's a day to raise awareness about menopause and support options for women in that phase of life.
And today we're joined by a women's health and gender-related nurse practitioner, Jenna Perkins. Jenna, thank you for being here today.
Thank you so much for having me.
So let's be honest, this is a topic we don't talk about a lot. Every single woman will eventually go through it, but it's embarrassing for a lot of women to bring this up, even with their doctors. So what would your advice be about that?
So the first thing is, as providers, we have to start asking these questions because as providers, we already know that women are going to be embarrassed. And hopefully one of the takeaways from this experience is that patients will be able to advocate for themselves if their provider does not bring it up and start those conversations.
And I know you wanted to talk in particular about GSM. What can you tell us about that?
So GSM is genitourinary syndrome of menopause. And so it's uncommonly known about, but it's very prevalent. So 50% of postmenopausal women will be affected by GSM. What GSM is a collection of symptoms that affect the genitalia and the bladder during menopause and the perimenopausal transition.
And so just in general, I mean, that right there is GSM, but with menopause in general, a lot of people hear about hot flashes and moods and anxieties changing. Tell us some of the more common symptoms and then some of the things that maybe aren't as common that people don't realize are connected to menopause.
Right. So hot flashes, mood swings, like you mentioned, headaches, palpitation, joint pain, and fatigue. These are all things that we talk about, but we don't talk about the overactive bladder. We don't talk about urinary tract infections and the painful intercourse, the vaginal bleeding that can happen with tearing that occurs with GSM.
And Jenna, I know so many women, because there is this lack of openness and discussion about this topic, a lot of times there are women who just suffer through many of these symptoms silently. What are some of the treatment options that are available that maybe they can begin discussing if they're going through this stage of their life with their physician?
So GSM is brought on by a decline or a decrease in hormones. And so really the way to fix that is to fix the hormones. So asking or requesting local estrogen to the vagina, testosterone, DHEA. These are all FDA approved products that can greatly relieve the overactive bladder symptoms, the urinary tract infection symptoms, the pain that women are having. So there are FDA approved treatments that are out there and accessible for women.
So we have to ask you, though, about hormones, because as you know, there's a lot of controversy around them. And there are a lot of doctors who are really anti-hormone because there's a potential risk to cause cancer. There's a potential clotting risk. What is your feeling about women using hormones for menopause?
So we know the data for local vaginal estrogen is that it is safe. There is no increased risk for breast cancer, heart disease, any of those kind of scary things that we think about with hormones. That risk does not occur when we are using these hormones locally to the vulva and to the vagina. There is absolutely no risk.
And Jenna, I just want to ask a more broad question. What can loved ones, potentially your spouse, your partner, what can they do, those around you, to be supportive as you're going through this stage?
So definitely accessing education and learning more about menopause and starting to ask the questions. If you have a partner that is suffering from infections, ask her how she's feeling. Make sure that you are advocating when you are in the visit with her, that her providers bring these things up and adequately address it, and really be that person, because it is an embarrassing thing to ask on your own, be that person to maybe ask the questions on their behalf.
All right, Jenna Perkins, thank you so much for all of your insights on this World Menopause Day. And the takeaway here is don't be embarrassed. This is all normal, and talk to your doctor about it, right?
Normal and treatable, for sure.
Great. Thank you so much for your time.
Yes, thank you.